specifically on how to cover COVID-19 safely for journalists and freelance journalists specifically. For you who don't know, Frontline Freelance Register is a members association that represents freelance journalists who are exposed to risk in their work. We have currently around 860 members based worldwide, and we advocate and campaign for their safety and welfare, as well as trying to bring to them resources so that they can do their work as safe as possible. And we are a project of the Frontline Club Charitable Trust. So without further ado, I'm going to introduce who we have today on our second webinar. We have Stephen Smith, who's the founder and trainer at SEPAR International, who worked with frequently over the last few years in terms of training for our members and other journalists. SEPAR are a risk management training and organizational development company. They do different trainings for journalists all around the world, and they have offices in the UK, Kenya, and Afghanistan. And Stephen, or as we call him, Smudge, will talk more about their training and their work. And I'm also excited that we have, and very thankful that we have Dr. Ahmed Shalabi. Ahmed is a good friend of mine and a doctor, a gastroenterologist at Chelsea and Westminster National Health Service hospitals. And he's been working on an emergency rota since COVID-19 broke out in the UK. And unfortunately, currently Ahmed is in self-isolation as he's been experiencing some symptoms, but we hope all well for you, Ahmed. And Ahmed I've known over 10 years. We worked together in when there was a revolution in Libya, and Ahmed was working with the field hospitals in Misrata, providing emergency medication and supplies to the hospitals in the war zone. So he's perfect to chat to our members about various things. Just a little bit on the structure of this webinar. I'm going to hand over to Smudge soon, and he'll be taking you through risk assessments and safety measures to take into consideration if you're covering stories on COVID-19, whether it's in hospitals or outside in public. And Ahmed will give some insight on how it is to work in hospitals, and maybe some information on PPE and protective measures, etc. So again, without further ado, I'm going to hand over to Smudge. So one more thing, if you have any questions as we're going along, please use the chat facilities in Zoom, or ask a question in the Q&A, and I will bring them forward to Smudge at the end of the webinar. Or if it's an urgent question, I'll keep an eye out on them and interrupt them if needs be. But without further ado, Smudge, go ahead.
Hello everybody, hope this reaches everybody well, and that everybody's in good health. The purpose of my little chat here is to go through the risk assessment. It's a risk assessment that we've designed with some input from various professionals. It's something that should be used in conjunction with a normal risk assessment. So if you like, it's like an annex. The first thing to be considered, and if you need a copy of this, please go to Sarah and she has copies of this. Yeah, but the first thing to be considered is the medical history of your team. And I know it sounds obvious, but if people have asthma or some kind of related ailment, particularly with breathing, then obviously that needs to be some kind of consideration there. Also on this, we have a number of references. The World Health Organization obviously takes the lead, but there's things like the NHS, CDC, the DART Centre, but also we have Freedom House, RSF, CPJ. There's a whole bunch of organizations now that over the last few weeks have been developing and building up their information, access to information, not just about physical protection, but also things like online things like fake news, but also legal considerations, and we'll talk about that in a second, and about giving help and assistance to wherever you are. And obviously the problem we have here for some of you freelancers is that you're in countries where their capacity to provide resources, or even when you go to somewhere like a hospital or medical facility, is quite reduced. So how do we look after ourselves in that respect? And then adding on to that is international and local media. You know, getting around the various unions or sort of media houses that you know there, fixers as well, stringers, people like this, and just getting the latest updates, you know, on that. As we basically go down this document, we have the normal things like dates, and then we try and identify locations close by with COVID-19 cases. This could be places like refugee camps, it could be places like slums, or locations where there's high density population groups and stuff like that. And if you're doing your stories around there, then obviously the thing to think about there is, you know, the possibility of that spreading around rapidly, and how you as a journalist go and deal with that. And then there's like a medical facility check. And what we're looking for, if we can, as best we can, is identifying medical centres, hospitals, or locations that if you are, you know, if you have the symptoms, or if you get into a bad state, that they have the capability to possibly help you out. And that might mean some travel, you know, depending where you are in the world. You know, your local, the most adequate facility might be some miles away. So it's about doing your research and identifying that. And that ties into things like the ability to get ventilators and also oxygen, which might be extremely difficult. But if you can, you never know. And from that could be your relationship, how you develop with health professionals and doctors, particularly if they want to tell their story. There'll be many people out there who want to tell their story, you know, because they want to get extra resources, they want to get extra help, they want people to get to know what's going on. And then what we have on the risk assessment on page 2 is a reminder of the symptoms. Okay, and it's always good before we go out on the job, whether it's ourselves on our own, or we have a team, including our drivers and fixers and people like that, just to sort of stand around and have a little chat about those symptoms that we need to look for ourselves, but also in each other. Okay, and then also think about quarantine, about how to do self-quarantine, and that might be really difficult, particularly with some people like fixers and stuff like that, where they see at the moment their ability to earn money being reduced. You know, a lot of international media are not traveling. A lot of media sort of gathering is reduced and stuff like that. And obviously that has an impact on people being able to put food on the table and stuff like that. So there might be people that you're working with that are very keen to give access and stuff like that. And we have to manage them appropriately. And, you know, we all have to be honest with each other and all that good stuff. And if we do recognize these symptoms, then we need to talk about how we isolate. And then what we have is some preparatory measures, things like soap, hand sanitizer, the face masks, gloves, sprays, and all these kind of bits and pieces and that we use to complement in preparing our equipment, whether it's our microphones as well as ourselves, our boom mics, our cameras, okay, our hands, where we touch, and creating a system where we are able to sort of maintain, if you like, that preventative measures. A good example of that is when we get in the vehicle, so we clean the vehicle, we use those alcohol, minimum I'd say 70%, and then when we go leave the vehicle, we do our work, we come back, how we prepare that equipment, and then get back in the vehicle, things like changing our gloves, things like this. And then also as well, one of the things that we've found out, and it's covered in the next section, is maintain that distance. So you imagine you're doing your story, you're doing your news gathering, and it's people want information. People, where you're working, people might not be too trustworthy on the information they're receiving from the government or other media. So when they see you on the ground doing your story, it's going to create curiosity. Unfortunately with that, sometimes is people can get quite close. So it's about continuing that message of distancing. So it might be, you may even have to do a sign, not just in English, but in a local language, about informing people to maintain that distance and try not to touch and things like that. And then what we have is things like how we should perhaps interview people. So not being direct, you know, basically talking to each other maybe at an angle. 45 to 90 degrees is a good example of that if we are on the ground. But, you know, face masks and things like that, keeping that sort of, we may even have to give the people that we're interviewing that PPE, may give them a face mask, may give them gloves and stuff like that, just to sort of, it's not only just for us, but it's also for them as well. Then, as a team, that team, as I said before, includes your drivers and stuff like that. So when your driver is in the car, that person stays in the car. You know, because if that person gets out of the car and starts meeting different people, you know, things may change and stuff like that. And obviously you want that vehicle as close to you as possible and all that good stuff. Then identifying things like, you know, the vulnerable. And if we're talking to older people and stuff like that, you know, we may not have those symptoms, but there may be a chance that we have it and we just don't know it yet. Okay, so it's a two-way process there. When we clean as well, when we clean equipment, obviously we want to clean it before, during the task. So when we have things like, for instance, if you are using a thing like a boom mic, you might want to take the muffler off, because things like that, where they have foam or made of a certain material, they're very hard to clean. So even though that might impact on the sound quality and stuff like that, you know, it's just another added sort of safety measure you might want to consider. But while we're using that equipment, we want to continually re-clean it and stuff like that. Also, you know, when we finish our job, when we transition back to the vehicle, we give the equipment back another clean. We give ourselves a clean, change the gloves back in the vehicle. Then, as we're progressing as well, particularly as time pushes on, and particularly if certain areas seem to get worse, and then there's this thing about this second phase as well of the coronavirus, is not only physically checking, but also mentally checking each other as well. And that's something that Dr. Ahmed can mention later about when you're in a health facility, when you're observing certain things, you know, obviously that can have an effect on the team as well. Moving on from there, we have some estimated surface life of certain materials. And again, that's sort of used as a guide to help us think about cleaning, and then possible negative outcomes to be considered. So these are just some. These may change, and obviously they'll be added on. A thing about this is, you know, there may be, when you turn up, particularly in an area where there's a lot of poor health or a lot of lack of medical access to certain communities, there may be a lot of anger to foreigners or strangers. Or they might see you as someone potentially bringing the infection into their community. There's also going to be this thing where we've seen across the board, across the world, if you like, a lot of businesses are suffering, a lot of people are financially challenged now. And so, unfortunately, a reciprocal aspect to this is criminal activity starts to increase. So if you turn up, particularly if you've got all this protective equipment, you've got things like cameras or whatever it is, or you seem to be in a better position than perhaps they are, then you know that may attract some criminal activity. There has been some cases of people spitting in people's faces and stuff like that. So that's another thing to consider. If you've got the mask on, obviously that offers some help. If you've got the face shield, like the full plastic face shield, that obviously offers better protection, but things like this as well. Then where we have these big communities, you know, refugee, IDP camps, slums, places like this, at locations where this virus can spread fast, but also that where they see themselves as forgotten communities that are not given, you know, the appropriate medical care and stuff like that. There could be a lot of anger there. And then we have protests. So at the moment, there hasn't been too much of that, or hasn't been reported on so much. But things like there could be protests against the government's lack of ability to protect its citizens, but also protests about unemployment and all these other long-term factors from this virus. So if you're covering that, obviously that can be a hotbed of infection amongst all the other normal problems that can have. And then we have this misinformation. So misinformation from trollers, from certain state-sponsored things, depending what country you're in. And also that ties on to new laws that are currently being developed by certain countries. There's some certain big countries that have created laws, not just for the media per se, but all social media, about not being negative publicity about coronavirus or the state's ability to deal with it. There's been cases where actual government leaders have turned to the media and have actually said, yeah, you are only to do positive media. And there's some emergency laws in certain countries, I'm not going to mention, but I'm sure you only have to go to some of the people I've referenced, where if there are judicial bodies that are looking specifically for negative impact media, not only to collect the information, but also to arrest people. And we've seen examples of certain journalists that are actually in prison currently because of coronavirus-related incidents. So good references for that. Freedom House, RSF and CPJ are really good references for that, particularly in the legal side, if you're working in some of these countries. Also then we have increased security forces. There might be more checkpoints and stuff like that. So we have the aspect of corruption and also overreaction. You know, some of these security trained officers might be poorly trained, and they might be worried. They might not have the right equipment. They might take your equipment. And then there's certain contamination areas as well. So again, from your fixers, your stringers, your local media, people like that, and also NGOs on the ground, you're gonna get, it's good to do investigations about where those hotspots are. I mean, that might be part of your story. And then as we progress, we've not seen evidence so much at the moment, but as things progress, particularly as it impacts certain areas more economically, food and water shortages, rationing, stuff like that, polluted water, secondary health issues. Okay, so we have the initial, obviously, COVID-19, but where's other communities, you know, where things like begging and stuff like that are a form of, if you like, earning money. Where that hasn't happened, and there's things like starvation, there's malnutrition, all these other bits and pieces, and then where sanitary sort of facilitations are not able to be used, things like infection or sewers, stuff like that, sewage, rubbish not being taken away, and you know, rats and all kinds of bits and pieces, so leading on to things like rabies, all these secondary bits and pieces. You know, at the moment, where we're sort of a couple of months into it, not so much of a factor, but as things progress, these could be a certain thing, particularly in the more poorer communities. And then, you know, there's going to be certain locations that you might want to do a story in where there's a high mortality rate. So there's, again, that's going to be another, if you like, focus of anger, you know, of emotional distress and things like that. And then possibly in certain areas is where there is complete collapse economically, where things like no electricity, no water, no phone network, okay, no civil order, even no fuel, you know, how that impacts on you as a journalist or as a team, and how you get through that. And if you want to talk more about that, then sure, we can talk about it later. And a good example of that is Khartoum last year. You know, it's a different type of what happened, but they had a complete collapse, and that got people thinking about how they had to, if you like, get through that, particularly communication-wise. Then there's like a little checklist of COVID-19 emergency numbers. So when you're doing your planning on your risk assessment, you want to think about sort of, if you like, backing up all your emergency numbers and points of contact. So your medical, also things like your security force commander, if that's something that's going to help you. Also community leaders or tribal elders, and then your local media, your NGOs, your civil society, stuff like that, your UN and your NGOs, and finally embassies. You know, all these hopefully will have that up-to-date information, or who you can call if you need a bit of assistance or you need a bit of advice. And on top of that, I would say perhaps some kind of legal consideration, depending on where you're doing your story or where you're doing your research. I would definitely look at perhaps some kind of legal tie-in where that's relevant. And then what we have is moving on is your reporting of COVID-19. So if you're doing your story and you feel that there's an area where it's hasn't been adequately sort of disclosed, and you're seeing signs and symptoms of COVID-19, there's a little checklist of how to report that. And then moves on to psychosocial considerations. The psychological impact, the good references for this is obviously the Dart Centre for journalists. The psychosocial reverberation, if you like, not just on the team, but also on how we're interviewing people. If you're going to a certain community, particularly if there's been loss of life or a significant number in a certain family that have been infected, how are we going about ethically and morally interviewing these people? Because obviously what we don't want to do is traumatize people further by how we do our interviewing. And then finally, we have some hand touching considerations. And I've covered some of these before. Things like door handles, doors, keyboards, your steering wheel of your car, shopping trolleys, you know, light switches, petrol pumps, anything you're going to touch. And thinking about, you know, your safe space. So when you get to your office or your house where you're staying, you know, what are you doing? Are you regularly ensuring that the door handles and that are wiped? How you're controlling? Is there a system of isolation, or is it not that good? You know, do you have to create your own system of isolation about who comes and who leaves? And if not, how are you going to manage that? Particularly in terms of people like your fixers and your drivers, and having that honesty, because, you know, potentially if you've got a driver or a fixer that has the symptoms, they may not want to tell you, because that might mean the termination of their work. So how we develop that relationship to get that honesty, which is obviously going to be quite difficult. So yeah, as I said, that's pretty much the risk assessment for the coronavirus. It should be used in conjunction with a normal risk assessment, and there's many different media organisations and safety organisations that have templates, including the FFR. If there's any questions, I'm more than happy to take.
There's a couple of questions already, Smudge. So someone asked, Joel asked, could you comment on covering COVID-19 in community correctional facilities like halfway houses, so not just in refugee camps, etc., but in other places where there are an enclosed population?
Yeah, so I would say, you know, when you're doing your story, what is it you're trying to achieve? If you're trying to get the sense of just interviewing people, then maybe you can take people out from the crowd or out from the location and have a place where perhaps there's not so much of a crowd. If you want to interview them person to person. And then obviously when you set it up, you know, have that distancing. You set up a separate room or an area with your chairs and bits and pieces like that, having that distancing, and then you have your PPE for you and your team, if you have a team, and the PPE for them as well. And then the things like having those chairs perhaps turned slightly oblique, and all the other bits and pieces, and then having things like, you know, the microphones offset in a certain way, and then that person comes in, gets dressed up, if you like, go do your interview, if that's how you want to do it. And then after that, once that person's left, you bag all the other bits and pieces that you're taking with you, and then clean stuff on site, and then take it back to the vehicle, or whatever you're doing from there. If you are going to somewhere like a correctional facility and you want to get in amongst it, then you want to think about, okay, if I'm wearing clothes, then perhaps I want to have a number of changes of clothes, for instance. So I go in there, maybe I wear a gown, maybe I got the gloves on, got the face mask. Maybe I wear a face protector, because I would say if you're in a correctional facility, for instance, that there is that possibility someone might try and spit on you, okay, and things like that. So, and then once you're in there, long sleeves, perhaps long trousers, and maybe some kind of, it's always better, I'm not saying wear Wellington boots, but if you've got a type of footwear that's less absorbent, then obviously the better. And then what you do is you go in, you do your story, if you like, and then as you come out, you basically disinfect, take all the clothing, put it in a bag, put on your new set of clothing, and then travel back to wherever you come from. Does that help? Is that okay?
I think so. Joel, let me know if you have further questions on that. But someone's asked further questions on what would you do in a scenario if someone doesn't want to keep their social distancing after you've instructed them to do so? What would be the best way for interviewees who won't cooperate and keep a distance?
I mean, easier said than done. I would say go back to your car, drive somewhere else. I mean, that's the thing. Unfortunately, you're going to have situations where people are going to be angry or going to have ill intent, and you've seen it already where people have been spitting on each other and stuff like this. And if you feel that's going to be the case, I would say remove yourself from that situation and maybe try and get the story somewhere else. Obviously what you don't want to do is escalate a situation. If you start pushing and shoving people, that's not always the best option.
Could someone ask more questions about the clothes that you wear? Like what the best types of clothes to wear, and does washing your clothes kill the virus? I don't know if Ahmed or Smaja could answer that.
I would say if you can, and it depends on the temperature, if you've got two layers, like a thin layer and then like a thicker outer layer, that helps definitely. And then what you can do is have perhaps 3 sets of clothing. So you can have your interview clothing where you do your bits and pieces, you have your secondary clothing that you can change into, and then maybe a third as a backup, just in case for whatever reason you just need that as a redundancy. Having the double layers, this just offers that better protection. And then normal detergent that we've seen with the soap at cellular level, and I'm sure Dr. Ahmed can obviously go into more detail here. At cellular level, soap actually takes away the fatty cells. That helps break it down. So that should be fine.
To add,
sorry, go on.
An option is if you are going somewhere, like a correctional facility, there is always the option of wearing a disposable long sleeve apron, disposable cover you can put on your shoes, and then after you finish your work, you get those, you take that disposable gown off, take all the disposable gloves off, putting it into a bag and just getting rid of it. That is possibly an option if you're going to an area like that.
Someone, I guess it's kind of related. Someone, Alexia, was asking, could you explain what the advantages of gloves are? She works in refugee camps and is washing and using gel. Is it more advantageous to be gloved rather than just keep washing your hands?
Based on the experience I have from where I've been working in hospital, I would say that we use gloves when we're seeing a specific person. So I don't have gloves on me all the time. I'm only using gloves when I'm seeing X, Mr. X or Mrs. Y. But then as I leave the room, I'll take those gloves off, I'll wash my hands, and then a patient, I won't put any gloves on, but I'll just make sure I'm doing regular for the day.
Can we talk a little bit more about, and something, questions that has come up with our members and other journalists about how you're removing the PPE, so how you remove it, like basically you can reinfect, so you're wearing PPE, but the virus could be on the surface of what you're wearing, and then you can just unintentionally reinfect yourself. Could we have a little bit of a discussion about the best methods on taking and taking off PPE?
Okay, so when it comes to taking off PPE, it's really important that we do this properly, because that's where it's more dangerous than actually putting on, because you've actually seen someone who may have the virus, and if it's on whatever your protective clothing is, if you don't do it properly, you might infect yourself or infect others around you. So the first thing to do is to take your glove off from inside. 1, 2, you get rid of it, and then you go and wash your hands, either with soap and water or with alcohol gel. Once you've taken your gloves off, you then take your apron off. The important thing, a lot of mistake people make is they take the apron off, they pull it off from the outside, where there actually might be virus or virus particles. The important thing is to take it off from the inside. So once you take the apron off, is when you're crumbling it up, it's actually doing it from inside out. So you're actually protecting yourself as much as possible, and then discarding that, and then wash your hands. What we're doing is, once we've done that, we then leave the room with our masks on. Because we've touched the handle, the door handle, we then gel our hands again, and then remove the mask. After that, I'll gel my hands one, and then we're free to do whatever else we need to do after that.
Yeah, that's really useful. Anything else to add to that, Smudge?
Yeah, I mean, if you can have if you like a clean room and a dirty room. So what you can do, ideally, if you've got a washing machine, is when you come in and you're going through the process just described, then what you can do is you can basically all your bits and pieces and put it in the washing machine. Obviously, once that's been done, you need to clean the outside of the washing machine, okay, either with soapy water or with gel. And then, as was said, when you move to the next room, then after you've basically done the door handle, you know, you take your face mask off, and then obviously have another clean. If you can do that, things like that make it a lot better.
Great. We've got a couple more questions that are kind of risk assessment focused, so I'll ask those questions and then perhaps refer back then to Dr. Ahmed to talk more about the hospitals and working in the wards. So just a few more questions that's come up which are related to risk assessment. So this one's for you, Smudge. What's the best option to protect audio and video equipment? This question's coming from Laura. Hi, Laura, who's one of our board members. She says that in Italy, cameramen were infected and women were infected, and a couple of them died because the virus remained in the microphones and equipment after the press conferences or interviews with people that were positive.
Yeah, sure. So as mentioned there, you know, you have the mufflers, you know, the spongy materials that you put in the microphones. So things like that. Before you go out on your assignment, take them off. Okay, and for the time being, any kind of recording with bits and pieces, any kind of sort of material like foam, it's very hard to remove that virus unless you put it through a washing machine through a soapy process, if you like. Okay, so things like that should be done. Also, you know, cleaning isn't just before and after, it's a continual process. So when as you're going about your work, you want your sort of alcohol wipes, okay, but also you can have spray that needs to be minimum of 70% alcohol, okay, and you should be continually cleaning. Also, when you finish your task, the cloths that you've used for cleaning and stuff like that, these need to be cleaned. So you need to have cloths for your active job and also cloths for your future job, and these need to be continually cleaned as well. because even though you're using alcohol, there is a very small chance that for some reason, depending on the concentration of the virus and stuff like that, that, you know, there's a spot you've missed, etc. So keeping this stuff cleaned and continually cleaned will help. Also, with cameras and stuff like that, you're just going to have to be meticulous. So you clean your equipment first, and then once all your equipment's cleaned, so what you can do is you can chalk out or you can tape out like a square, and in there goes your dirty equipment for your microphones or potential dirty equipment, your microphones, your cameras and stuff like that. And then you have another square, which is your clean square. And then when you take a piece of equipment, you clean it, you take it, strip it down with your alcoholic wipes and stuff like that. And obviously alcohol evaporates as well with some of the sprays. And then once you've done that, you move it into the clean square. And you do it individually, piece by piece. Once all that's done, then obviously you can decontaminate yourself, as mentioned by Dr. Ahmed.
One question of someone has a follow-up question on using mufflers. She's been advised by one producer that they can just still use them, but use them only once and put them in a sealed container for a few days. Does that help in terms of killing the virus from your muffler, or you wouldn't advise that?
I think personally that it's unless you can definitively clean it by like washing it really well with soapy water. I don't know how that will, you know, if it deteriorate because of that. You know, it's about what we try and achieve here as journalists. Is it quality as opposed to getting the story out? You know, is that going to really impact that much on the sound quality that we take that risk? I mean, you know, I can't speak for the journalists, you know, that's their job and stuff, but, you know, for the sake of just removing that piece of equipment for this, particularly if we're in a hospital or a place where perhaps there is coronavirus, you know, do we really want to increase our risk there? And also as well, you know, if we're moving around and we have this piece of equipment, maybe that's carrying it and we're becoming carriers. So, I mean, you know, that's something for the audience to decide. But I would say, in this case, I wouldn't use it.
This is another question that's come in. When you finish filming production, like interviewing other people during the day, should you afterwards take a 2-week quarantine and self-isolate? So I guess after doing a story where maybe there's a high-risk area of infection, should you self-isolate and take 2 weeks off?
I would say, and I'll pass on to Dr. Ahmed in a second after what I say, I would say there always has to be a period of self-isolation. You know, there isn't really a situation. If you're doing this story, you know, the factor half this story is we need to self-isolate. Okay, particularly if you're going into a location where it's coronavirus heavy, you know, chances of some kind of infection in any part of the team, even if it's just one person, you know, they are increased. So it would be irresponsible not to consider any kind of isolation. And I'll pass on to Dr. Ahmed, if I may, to go a bit more into that.
So it's a little difficult because obviously here in the UK, the advice for healthcare workers or key workers is a little bit different than from the rest of the population. For example, for us, we were always advised to only isolate if we develop symptoms, and otherwise we'd expect it to be coming to work. And that kind of made sense, because if every healthcare worker is exposed to coronavirus now, if we all isolated, then there wouldn't be anybody left in hospital. I would say that if you're working in a high-risk area and then you came back, isolating would probably be sensible. Whether you'd need to isolate for a full 14 days, my gut feeling would be probably not. Because if you said 7 days, if you were going to develop something, you would have developed it by day 7. That's my feeling about it.
I would like to add to that as well, as a team, you know, when you leave a certain area, you've done your story, is that you check in on people like your drivers and your fixers, and just have a regular check-in with them and seeing how they're feeling. You know, let's not fall into those bad habits where we get what we want, leave somewhere, and then we forget about those people that helped us get that story. Because, you know, they may have these symptoms and they may be worried and they may need some kind of help. And, you know, as a team, we should be part of that process.
We have another question about sort of equipment. One viewer is talking about that at their last production, they packed all their equipment into pelly cases and then arrived at their safe location. And then they cleaned their pelly cases from outside and let it rest for 24 hours before opening the cases up and then cleaning the equipment inside. Because they couldn't do this in different production spots because there were many. What's your advice on such a procedure, Smudge, and what kind of things should you look out for?
Okay, so a couple of key things there is in these Pelican cases for these equipment, you have the foam inserts where you put the equipment that obviously protects. You know, so due to the nature of the material, it's quite absorbent, and it could be argued that, you know, things like this are going to could hold the virus. So I would say going through many processes of cleaning with alcohol and stuff like that, making sure that the case inside and out, as well as the foam inserts, are cleaned well. It's not definitive, but things like laying stuff out in the sun as well, once you've cleaned it, things like this do help in certain things, but although it's not 100% confirmed with coronavirus. Just making sure that we have, as I mentioned before, having that dirty area and then transition everything individually to the clean areas. So you know that you're not cross-contaminating something once you've cleaned it, and that you know item for item, whether it's the case, the handles, the foam inserts, from the batteries, from all of our bits and pieces, that you've cleaned everything individually, and then that once it's been cleaned, it's in that clean area. I hope that's okay.
Yeah, that's good. If anyone has any follow-up questions, I'm monitoring, so do ask. One more question about cleaning, and then we'll move to Ahmed. So someone was asking, there's a lot of advice on hand washing, but how about washing your face? Is there any advice on keeping your face clean, or how do you do that?
I'll hand over to Dr. Ahmed in a second. I would say, obviously, a big factor of this is not to touch your face, isn't it? Okay, whether you've got your hands that have been cleaned with soap and water, or you're wearing your gloves. So in cases like that, it is not to clean is try not to touch your face. It's obviously more skin friendly to use soap and water, but if for any reason that you need to, you feel that your face is being exposed, then obviously alcohol is going to be better than nothing. And particularly where we, as we talked about earlier, where there's going to be those locations where there's a lot of people perhaps, and people are getting a bit close, and you may feel that you need to basically mid-clean. I mean, that could be a factor depending on your story, is where you take yourself out of the situation, the whole team goes for a clean, including the face, and then reinserts themselves to complete the story. You know, things like that aren't necessarily a bad idea. And Dr. Ahmed, if you want to add to that, please.
I would say don't clean your face. Don't go anywhere near it, especially when you're in the area. It's such a big risk. It's such a big risk of just transferring a possible viral particle right here around your face. I think try avoid if possible.
I think that's quite a definitive answer. Thanks, Ahmed. I'm still going to monitor if there's any questions that haven't come up in relation to risks. Someone's asking a question, but let's move to Ahmed first, and just talking about more some medical issues and working in hospitals.
Sarah, can I make one more point for a second?
Yeah.
We were talking earlier about risk factors and people who are most susceptible to disease, to getting it, such as like people with asthma. The one thing I would add is if you're over 50 and you have heart problems, what we're seeing in hospital is it's almost like a sweet spot for the coronavirus are male And and if they're between 50 and 70 with heart problems, they get really, really sick with it if they do get it. So another risk factor is heart disease. If you've had a heart attack in the past, if you've had heart surgery, if you've had stents put in, add to that extra comorbidity such as diabetes or high blood pressure, all of that together puts you at a much higher risk. So please look after yourself.
No, that's good to know. So I mean, that's really important. Smudge.
Yeah, and just to add to that as well, there's things you can do as well to make sure that you're in a better position to if you get it. So things like having a healthy lifestyle, you know, eating your vegetables, your fruit and bits and pieces like that, keeping hydrated, perhaps keeping off alcohol and stuff like that, you know, so that if you do contract it, that physically you're in a better position. You know, that's something, you know, I would say, and that, which is quite hard sometimes, particularly if there's certain journalists that are, you know, burning the midnight hours to try and get the stories out and stuff like that. You know, self-care sometimes, you know, gets left behind a little bit, but things like that, having a good healthy diet, keeping really hydrated and stuff like that, having your body in a stronger position. So if in the unfortunate event you do contract it, that your body's in a stronger position, you know, to deal with it.
Great. Ahmed, could you talk a little bit more about, because obviously you've been working in some emergency situation and these COVID-19 wards. I know a lot of our members are keen to be able to document some of these stories in hospitals. Of course, access is an issue, and that's not something you can really talk about. But if a journalist is able to get access to a hospital, can we talk a little bit more about what kind of things they should consider when they're in the wards in terms of safety issues, in terms of how they're interacting with your colleagues or with patients, etc. Like, what should they expect if they are able to access any health facilities?
First of all, I would say keep yourself safe. No problem in doing a story if you don't feel adequately protected or if you don't have the adequate PPE. The second thing I would say with all these stories, there are multiple facets. So you've got the patient who's quite ill, but what's really interesting about COVID-19 is that patients don't realize how ill they are. So they might be deteriorating on high flow oxygen, but when you tell them that, they'll look quite shocked and tell you, well, really? I don't feel too bad. Why is this happening? So that's one point. The second point is the healthcare professionals themselves. A lot of the wards, hospitals are short-staffed because a lot of people are sick. And so therefore they're caring for much sicker patients, and there are less staff. There's a less amount of staff helping them. And they've also seen a lot of people die with this disease. So they probably already were working under a lot of stress. So it's important we take that into consideration. I've seen a lot of my colleagues, I mean, even me, when I was first doing this, because if I go back, I think the hardest thing for me looking after these patients is speaking to their family members who can't come to visit. So you're basically updating them on the phone and you're telling them how ill they are or what's happening with them, etc., etc. I won't lie, the first few times I was speaking to family members, my voice kept on breaking because it's really, really hard telling them that their loved ones might be dying. And they're telling you on the phone that this is the only loved one they had. So that's really hard. And then seeing my more junior colleagues experience something like that. And then the moment somebody asks if they're okay or not, they break down into floods of tears because it's the first time they've ever experienced something like this in their career. So I think those are like the multiple facets of covering a story like this. And after that, a lot of them don't have adequate PPE. So they're looking after these patients, knowing then they themselves are not adequately protected, but are being told by their own organizations that no, this is okay. So these are the multiple facets that probably you'll be looking into when you're covering the story, provided you get access to the hospital in the first place. Because I think, especially in the UK, I don't think many news organizations or freelance journalists have had access to hospitals.
So I was trying to basically ask you, like, what if you're a journalist going into a hospital ward? What's the atmosphere like in terms of, is it really busy? Is it hard to navigate your way around different wards? And how should you approach patients if you want to cover that, etc.? What would you advise?
So from my perspective, so I'm just talking from my own experience. The wards in itself, actually, it's been a very serene atmosphere because there's much less people around due to restrictions, etc. So I guess the atmosphere has been more serene, more quiet, less noise. The patients are very lonely. No one's visiting them, essentially. The only people they're seeing are the nurses, the doctors, the physiotherapists. I guess if a journalist is on the ward, I think if they've protected themselves properly, they have the adequate equipment, and they look after the hygiene of their equipment, their own hygiene, and look after the patients they're seeing, I don't think they should be doing anything else different other than covering different aspects of the story, and just realizing that a lot of these patients usually, if it was any other illness, they'd have their family members around them going through the experience of them sitting at their bedside, when now they're just going through this alone. Which is why we're getting a much more phone calls to the ward, because every time they feel a bit more breathless, they feel something different, they're calling their family members up saying, oh, this is how I'm feeling, this is different. And so these family members are then calling the ward and asking for an update.
We had a bit of a discussion before we started the webinar on face masks and some different variations, because of course there's a big shortage, not obviously with the hospitals, but in general. So I don't know if Stephen, Smudge, you wanted to speak, ask Ahmed about different types of masks that would be useful in these circumstances. I'm not sure Smudge can hear me. You're on mute.
Yeah, no, sure. No, Ahmed, we were discussing it. Yeah, Ahmed, if you want to go into detail about, mask fitting and mask testing and things like that.
Okay, so a lot of people talk about the N95 mask, and the N95 masks basically removes about 95% of the particles that are 0.3 microns in diameter or larger. But that's not adequate enough if these patients are going through what we call aerosol generating procedures. So in that case, you'll need something called an FFP3 mask, which in theory would remove about 99.9% of these particles. The fear is with coronavirus particles is if something which is also, what is an aerosol generating procedure? Could be something like CPR or suctioning or or ventilation or something along those lines, where you fear that this procedure will break that particle down to smaller particles, which will go through what you would deem to be a normal mask. Now, even the FFP3 masks, there are those with a filter, and there are those without a filter. And this is where something called fit testing comes in. If you are male, you need to be clean shaven before, whenever you wear a mask like this, to make sure no other particles come through. You need to be fit tested. What fit testing involves is you try the mask on, you then put a hood on your head, which has a hole at the front, and then they start spraying a spray, either bitter or sweet, into that hood, and to see whether you can smell. You know, if you pass on the normal FFP3 mask, then that's adequate. That's an adequate mask for you to use when you're seeing any patient with COVID-19, especially those who are having aerosol-generated procedures, especially in my line of work, because as a gastroenterology registrar, I do a lot of endoscopies, and an endoscopy, given the fact that it's a procedure that goes down the gullet, there is, as the scope is coming out, a lot of it does generate particles, and that tends to break these particles down even further. However, if you fail with that, you then go on to a different kind of mask, which is a bit tighter, doesn't have a filter. This is called an FSM 18. This is the one I passed on, so I failed the first one, and this is the same mask that I passed with, and it's been in my bag ever since, just in case I needed it, in terms of an emergency with persons having a cardiac arrest and needing CPR. To begin with, when we first started looking after COVID-19 patients, the guidelines were that you looked after patients, any COVID-19 patient, using a normal surgical mask and a normal disposable sleeveless apron. That was deemed to be sufficient enough, despite many reservations. However, the advice from Public Health England were this would be sufficient enough. Hence, this is what we were doing. And lo and behold, I am now currently self-isolating with COVID-19 symptoms. Over the past week to 10 days, the guidance has changed, where if you're looking after patients with COVID-19, especially areas where there might be aerosol generating procedures, here we need to be wearing tighter masks, especially these FFP3 masks. And then if you were in the general areas, in the ward, in between where these patients were, you'd expect to be wearing surgical masks at all times. This is definitely vastly different from the advice that came out 4 weeks ago, 5 weeks ago. And the cynic in me wonders whether the advice keeps on changing as more equipment becomes available.
That's great. We had one of the questions before in our previous session was asking about all these kind of precautions you're taking in terms of PPE equipment, etc. Is that just for working in hospitals or in other places? But I would assume it's in any high-risk places you need to upscale your PPE. But if you're sort of working you're filming outside, you don't necessarily need that protective equipment. What was your?
No, it's just high risk places.
Yeah.
That's what I'd say, high risk places. I wouldn't expect to be doing that if somewhere low risk or somewhere where people are going about their normal daily activities.
Great. We had a couple more questions just come in. Goran has a question specifically to Smudge. Smudge, can you say something about the current corona situation in Afghanistan? How bad is it, and how bad do you think it will get? And when do you think it's advisable to go there to cover the situation?
Yeah. So at the moment, Afghanistan is one of those countries where the ability to analyze and test and then deliver accurate numbers is quite poor. For a bit of a backstory, Afghanistan, if you're someone in Afghanistan and you're sick, then you normally go to Pakistan or India to get help. Okay? Because Afghans consider that Afghanistan doesn't really have the infrastructure to give adequate medical care. So when it comes to coronavirus, they're even at a lesser sort of ability, if you like. And The thing with Afghanistan, there's been big movements of people coming from Iran, from that side into Afghanistan, and also a lot of transients between Pakistan and Afghanistan as well. So there's a lot of movement of people, and the ability of the state to analyse that is really poor. So at the moment, there is lockdowns going on, and if anyone sees any recent pictures of Kabul, the streets are empty. But there are certain areas as well where there's still people gathering in big crowds and stuff like that. And the bottom line is, people just don't know how many people are infected and how many people are dying, because lots of people actually die of lots of other things in Afghanistan, and these numbers are it's very hard for these organizations to analyze and actually give a representation of things like malnutrition and things like this. Also as well, a lot of NGOs, the UN as well, most of their staff have actually moved out of country. So the ability of these outside agencies to analyse what's going on as well is pretty poor. Fortunately, there are quite a few freelance journalists that are in Afghanistan, and that are in places, these hotspots like Herat, which is near the Iranian border, where the coronavirus initially started, and then they're doing their best to sort of, if you like, pass on that information. But the bottom line is Afghanistan at the moment, you know, they're putting in, as weak as the government institutions are, they're putting some measures, but no one actually knows at the moment the actual impact. So to give an accurate assumption of when it would be safe to come back to Afghanistan to do this, I would say I can't say. And also flights. There are some flights that have started, but they're purely going in the opposite direction, and they're therefore like displaced peoples and stuff like that. So I'm sorry, Brian. At the moment, if I do get any more information that leads to that, I'll let you know. Microphone.
You're on mute. Sarah, you're on mute.
Apologies. So questions for the Ahmed. Could you list other particle generating procedures that you should be wary of? And what about covering your hair, and is there any sort of hair protection or any advice on washing your hair?
Okay, so there is a list by NHS England about what they consider to be aerosol generating procedures, and I'll list them right now. Number one, you have intubation, extubation and related procedures. For example, manual ventilation and open suctioning of the respiratory tract. You have tracheostomy or tracheostomy related procedures. You have bronchoscopy or any procedures involving the ear, nose and throat. You have upper gastrointestinal endoscopy, surgery or post-mortem procedures, especially ones involving high-speed devices, dental procedures, for example, high-speed drilling, non-invasive ventilation. This is something which we do on our wards, some of our wards, and in ITU. High-frequency oscillatory ventilation, induction of sputum, which is something physiotherapists do with some of our sick patients, and something called high-flow nasal oxygen. So when you're giving flow of oxygen above and beyond 15 liters of oxygen directly through someone's nose to help sustain their lungs while they're going through this illness. Those are the list of aerosol generating procedures that you should be particularly wary of, especially during this pandemic.
And in relation to
for hair,
yeah.
I would advise, if you are doing it, then there's no harm in using a cap, a disposable cap. Something similar to what I have a picture that I can send you later, Sarah, how I had a cap, although I don't have much hair, I still had a cap around, which obviously you would then have to dispose of. About washing hair, I would say I wouldn't treat it any differently than how you would any other day of the week. I wouldn't go start washing your hair more regularly just because of this, because then you might be increasing the risk of transmitting particles.
Great. I don't think we have any more questions so far. Is there anything that we haven't covered, Smudge or Ahmed, that you feel in terms of safety that you can sort of raise or talk about? I think we've covered everything. So the risk assessment that Smudge was referring to at the beginning of the webinar, we'll be sharing on our social media platforms and on our website. And I'll be emailing to all the participants or people that registered for the webinar. So you can have a look to that, and that has also some information on where to find other information from. But yeah, so just leaves me to thank you all for participating. Thank you so much, Dr. Ahmed. Please get better. Please continue doing the amazing work that you're doing. And to Smudge, thank you so much for providing this service for our members and other freelance journalists. It's really, really great. Please look up SEPAR International. They do different trainings around the world, and just go on their website as well for more information on their services. People are saying it was good to see you, Smudge. I think you have some people that you know on the chat. But yes, thank you everyone, and we'll be doing more of these seminars and webinars in the weeks coming. So please do look up on all our social media platforms as well when we're sharing. Thank you
for having me. Thank you.
Cheerio. Stay safe, everybody.
Stay safe, everyone. Bye-bye.
Bye-bye.
Stay safe.